Welcome, everyone. Dr. Mandell here with you. Beautiful day or night, regardless of where you may be. I want to go ahead and bring my face back in. I want to say hello to everyone out there. Today, I have a very exciting topic about sciatica, pain down the leg, lower back problems, people who experience conditions from herniated disc, bulging discs, facet syndrome, facet tropism, sacroiliac problems, or muscular imbalances, sacroiliac problems. There are many things that can lead to sciatica, but I have something beautiful I'm going to share with you after doing my homework, and I really hope I can help the millions out there worldwide. And I ask you to share this video because I think that you will enjoy it and make a change in someone else's life. So let's move forward right here. Let's go into the sciatic nerve. The sciatic nerve is the longest, greatest, fattest nerve of the body. That nerve stems from the lower back of the L4, L5, S1, S2, S3, 5 lumbar nerve roots that come together under the buttocks area, go down the leg. That nerve is about the size of your thumb. We are broadcasting and streaming live. I want to say hello, chatters. Thank you for being here in the room today. But you can see the pain generally can come from behind the thigh, outside the thigh. Once it makes its way below the knee, you can get burning, tingling, numbness all the way to the big toe. If we move higher up here, you can see the sciatic nerve. It is basically pressure or irritation on that sciatic nerve. Most sciatica is not, or let's say most sciatic conditions do not come from disc conditions. They come from extradural, outside the spinal area, which I'm going to share a lot of great stretches, nutrition, and things that can help you naturally before you start popping those pain pills, because that's not the answer. Let's move up here to pronated normal feet. Here is a very important thing about pronation. Pronation means that the foot is kind of falling downwards, inwards. The most common condition is pronation. Millions and millions of people have it. If you look at the outside of your shoe, you'll notice you're wearing the outside of your shoe more than the inside, that you are pronated. When you're pronated, the arch starts to drop and you start developing other imbalances. What are we talking about as we talk about other imbalances? So let's look at this picture right here. This picture shows us when we rotate, we internally come in medial. The leg internally rotates at the knee joint. The hip internally rotates at the hip joint. The pelvic goes forward. Forward pelvic. Anterior pelvic tilt coming from pronated shoes, pronated feet, quite common. Pronation leads to sciatica. So here you are going to a medical doctor or neurologist, and they're giving you epidurals, they're giving you medicine. You're not getting well because you haven't corrected this problem. So I want to make sure with everyone out there that if you are pronated, look at the outside of your heels. If your heels are worn out more than the inside, you need to make sure you get a good support or orthotic inside your shoe, or a good shoe. Most important thing about lower back, make sure you have a good support in the lower back area. Support that lumbar spine. You have a lordotic curve. Without it, it will affect all the way up the spine, mid-back, as well as into the neck area, which can lead to a lot of neck problems. Millions of people out there have forward head posture because they're spending so many hours in a car, at a terminal, on a desk, reading, texting, whatever you're doing, and a lot of it can be helped by getting a good support for that lower back to support that lumbar lordosis. Very important. Let's go into some great exercises here. Bird dog exercise. I love this exercise. Great core exercise. I recommend everyone to do this exercise. This is something where you'll kind of alternate your arm and your legs. And you go up and hold it for a couple seconds, and you'll come back down and do the opposite, and do several sets of those, 12, 15 sets of those. And when you get better at this, I recommend to not only continue to do it, but do it up on a ball like this. This is really good proprioception for the brain. This will really strengthen the core muscles of the lower back, help sciatic conditions, help lower back problems. This is one of my favorite exercises, and it will really do wonders for you to get a strong core. Core is, if you start reading a lot of the studies out there, clinical studies in JAMA, core is the primary essence of good posture and a strong back, as well as good posture and a strong neck. Core really makes a huge difference, particularly in this condition that we're talking about. We talk about the hot-cold packs. Anytime inflammation on a nerve, I like using ice. Ice can be used at any time. Heat can be used more on the muscle. When a nerve's inflamed, stay with ice. About 10-15 minutes, use a paper towel between the ice pack and the skin. It will make a huge difference. Chronic conditions, heat, moist heat, thermophore pads, moist heating pads are all very good. Hot showers, hot baths are all very good as well. Let's go into the old turmeric. I love turmeric, but if you're going to take turmeric, there are many different companies. You can look on Amazon. Make sure you're taking piperine. Piperine's a black pepper. The black pepper helps assimilate it better. Generally, the common milligrams is around 500, 550 milligrams of turmeric, as well as boswellia. Boswellia is one of my favorites, about 500 milligrams per pill if you were going to take it that way. And in the old ginger, about 500 milligrams there. So you pretty much are all about the same. There are some formulas that I was looking at just recently, a great turmeric and boswellia formula together. There's a lot of great formulas out there. Do your homework. My best advice for everyone out there is to read the reviews. I read the reviews. When I buy things, it doesn't matter how much I know. This is a foreign company. This is a person that's trying to make a living or trying to make money. I want to bet in my best behalf that I'm betting the right odds. I want to make sure I'm taking something good for me. So read those reviews, and I think that will really help you. Okay? Prolonged sitting is probably one of the most common things of lower back sciatica conditions. You need to get up and change positions. Make sure you have that support behind your lower back. But we're not designed as human beings to sit for prolonged periods of time. We look at this exercise right here, just getting into that kind of like a cobra position, extending the back backwards is extremely good. Why is that good? What we're doing is what the lumbar spine has a lumbar lordosis, and when we have disc problems, the discs generally herniate towards the back. So as we put it into more extension like this, we're putting pressure to bring that disc forward again. There's a lot of different theories and studies on this, and this is known to help many disc herniations, bulging discs, and that is actually a very good exercise when it comes down to sciatica. The next thing I want to talk about is the old tummy. You can do all these exercises, which are great, but you must really lose that weight. That weight's putting excessive stress on that lower back. That stress is just causing a tremendous cycle of inflammation upon the sciatic nerve root. That's one of the most important things, not only for diabetes, blood pressure, but when it comes to your health, something very important. I love the knee chest exercises. I think that they're great. It kind of opens up the lower back. It opens the holes up where the nerves come out of. When you do that, you want to contract the abdominals, push it kind of down to the mat. Keep that knee down, by the way, that other leg, and kind of do both of them. Hold it. Make sure you get a good stretch. You can actually do both knees after. Now, why am I explaining that the knee chest is good? Because when we're actually bringing the leg up, if you look back here where the nerves come out, where these yellow nerves are, as the pelvic rotates this way, as it comes up, look what we're doing. We're opening up those holes where the nerves come out of. That's why it's actually good to sleep with a pillow underneath your knees, because by bringing the knees up, you're not only relaxing the iliopsoas muscles, the hip flexors, but you're actually opening up those holes where those nerves come out. The old glute massage, one of my favorites, and many people don't do this. If you can get a good therapist, maybe you can train your wife, your husband, your friend, your girlfriend, your daughter, your son, whoever you want. You can get in those muscles and start stripping away. Those muscles seem to contract, and that can be affecting something I'm about to show you in just a second. Chiropractic adjustments are excellent when it comes to sacroiliac imbalance, because one pelvic can be higher than the other. Remember, the pelvic rocks back and forth. So as we look at this here, see if I can come up a little higher. When we walk, we go back and forth like this. The pelvic rocks back and forth. This is the pelvic here. This is the ilium. When one pelvic comes up higher than the other, quite commonly seen, that's indicative, in many cases, of sciatica. So you can actually, if you are imbalanced and you can balance the pelvis out, I've had literally, I'm not exaggerating, thousands of people over many years who have responded, boom, after one adjustment. So it's quite exciting, and we can never ignore that, because chiropractic is quite powerful for many of these conditions. We look at the piriformis muscle. That's the muscle that seems to choke on that sciatic nerve. That piriformis muscle runs from the outside of the sacrum to the head, around the head of the femur, and that sciatic nerve runs right underneath it. So if that sciatic nerve, let's look here, if that sciatic nerve starts to choke down, if that piriformis muscle starts to choke down and squeeze and contract, you can start pinching on that sciatic nerve. All right? Another common thing, guys, even some girls, what about the old wallet? If you got a wallet in your back pocket, probably one of the greatest tips you'll ever hear is take it out. Now you may say, wow, Dr. Mandell, I'll never, ever, ever forget you. I hope you don't. But if you take that wallet out, and that is probably one of your main causes because it's throwing the pelvic off higher or lower on one side as compared to the other, that can definitely cause sciatica. If we look here, the sciatic nerve, in this particular condition, even massaging and working different parts of the leg can send trigger points and stimulation back to the brain that can help sciatica in from the lower back. So sciatica is a very hard thing to pinpoint, to say exactly where, but I'm a big believer in foot reflexology. I'm a big believer in trigger point therapy, and by getting in there and stimulating other points within the leg can help your sciatica. Now remember, these are remedies. In some people, you're going to say, wow, what a blessing, what a miracle, it's gone. And other people, you say, well, that one didn't help me, so you go to a different remedy. Let's go on to something very simple. Now, this is the simplest form of yoga. You can meditate, but remember, when you bring your knees up and you're putting in that 90 degrees, that is good. That takes pressure off. It opens up the nerves, as I explained to you just before on the spine. It widens, it opens up the disc, opens up the nerves, and the hole called the intervertebral foramen. Very, very good. Look at this here, sitting piriformis. I really like this. This is a great stretch. You can do this at your desk. Now, when you go forward, try to bring your chest to the ankle. Okay, so as she's doing that, she's feeling the stretching, the burning on the outside, on the right side. But when you lean forward, lean towards that ankle on top of her knee, and you'll feel it even more. You can do this supine, laying on your back. Another piriformis stretch, you can put the knee, that leg behind the knee, pull the leg up, and obviously here she's working her right piriformis. We all together here? She's working her right piriformis. Now, another thing that's been quite helpful, I like sometimes even taking a tennis ball, put under that piriformis muscle, just lay on it and let gravity do its job. That can be a lifesaver for you. I've done it. I've done it particularly when I was in Asia, doing lots of traveling, and I say, what do I do when no one's around that can help me? I got to learn to help myself. Okay? So the old piriformis there. I like this right here. People who don't like sitting in chairs, sometimes getting up on one of these little balls, these yoga balls or these fitness balls, they have these things made. This is really good because what does this do? It really helps stabilize the core. So this is something you want to think about if you do a lot of sitting. I love the pigeon stretch. Pigeon stretch is really good for that sciatic nerve. I think it's excellent. If you can get in that position, you may not be able to go as far, but I think this is a great stretch. Now we look at the core muscles, and I'm going to post a couple of videos underneath. Please look at these videos, particularly on the transverse abdominis muscle, most important muscle of core. We can do that by just sucking in the abdominal muscle, like sucking in the stomach to our navel to our spine. I'm going to show you how to do that. I'm going to post a couple of my old videos underneath the link, and so please look at these. I'm going to show you a great way to really strengthen your core without hurting yourself, and something you can do anywhere. If you are a first timer, this you're going to love. I promise you, you'll love it. So we're mainly looking at the transverse abdominis and the upper left side here. There are other aspects of core, but the transverse abdominis really is what stabilizes the lower back, and it will help you with sciatica. The other way that we work core that you heard about is the old plank. Okay, a lot of people can't get in this position, so the transverse abdominis, particularly this one right here, I will share. I'll make sure I'll do it right after this, and I'll put it right down in there. Look at some of those videos I'm going to post for you. That's really it. That's a lot of information. I really hope that you enjoyed that information. I really enjoyed it. Why? Because it really brings back a lot of great memories and great education back in my mind. These remedies are so good for you. And I'm telling you, before you start popping those pills, and I'm not going to go into the pills and the kinds of pills and the types of pills, but try these remedies first. You can really help. The majority of people will see results. The key thing, like people rush to like epidurals and surgery, they can't withstand the pain. But understand that you can still get the epidurals, you can still get the surgery, but if those muscles are weak and you're doing all the wrong things, you're really not making the right progress. I want to send blessings out to everyone out there. I really appreciate the chatters. A lot of people out there today. Share this video. Check my channel out, Motivational Doc. Great self-help videos like these. I got so much great nutrition. I think you really enjoy it. And if you want to give me a big like here, and as well as Facebook, Motivational Doc. And I'm asking people out there, if you don't mind leaving reviews on my Facebook, I would really appreciate that too. Anyways, until next time, which will be real soon, make it a great day. Bye-bye now.